All right, so welcome everyone to our February office hours webinar. My name is Cristina Hernandez. I use she, her, ella pronouns with the Community Partner Outreach Program with the Oregon Health Authority. So today we're going to have some of the topics that we'll be sharing with you today is around the OHP nutrition benefits through the health-related social needs benefit that launched in November. We'll also have some updates for you all about OHP Bridge, and then some other updates around the public health emergency unwinding, and then some other things that you might be seeing over the next year as we rebalance some of those renewal dates. And then we'll have some time at the end for discussions. So with that, if we go to the next slide, and I believe our first, so I will pass it on to Shauna to cover that first topic. Thank you so much.
Oh, thank you so much. So I'm Shauna Kerr. I use she, her pronouns, and I'm an operations and policy analyst on the waiver team. My focus is nutrition. And we also have over my right shoulder is my lab Tupper. You might see his shadowy resemblance in the back. He refused to leave this afternoon, so hopefully you're okay with him. And let's hope that he doesn't see a deer or something and start barking. Um, but really, we wanted to take a little bit of time today to go over the nutrition benefits. So we'll do an overview there. And then also, hopefully, we'll all walk away with a little more understanding around eligibility requirements for the different benefits that we launched. So let's go ahead and go to there we go. Very quick overview here. I'm sure a lot of you have seen this or a slide that's similar, but just as a reminder, Climate and Outreach and Engagement went live last March in 2024. Housing recently went live, and those benefits went live in November of 2024, and then nutrition went live. We started our rollout this past January, so just a little over a month. Let's go to the next slide. Um, okay, let's start with core values. I thought it might be interesting for some folks to kind of see how we got to where we are now. Oh, we can go on to that next slide. We have a nutrition work group across the state with partners from WIC and SNAP, home and community-based services, many different partners. And the group started quite a while ago, actually, and really decided on some underlying values of centering food as nourishment. And we have some of the bullet points here, but it really helps connect families to cultural traditions. We want to be able to lessen isolation. Food is not only nourishment, but it's how so many of us show our love. We build memories through food. Just think about all the different special occasions and holidays of, families and friends getting together and prepping food and sharing food and just all those wonderful joys that it can bring. And then also really, keeping in mind to help folks reconnect with body cues. Am I hungry? What does this mean? Those types of things. And overall, we want to be able to utilize food and nutrition to improve our physical, mental health, and well-being. And trying to really take a holistic approach on how we define the benefits. Let's go to the next slide. So these are our health-related social needs nutrition principles and goals. And so our group members really inform these goals, well steeped in health behavior theory and current nutrition literature. Our guiding principles on the left here are we really want to keep in mind that culturally appropriate and being responsive, keeping things person-centered. We also want to acknowledge the role racism and colonialism in defining which food patterns and are considered healthy or unhealthy as you know, across many different cultures or all cultures, there are healthy foods, and we want to be able to consider all of that and be culturally responsive. And we also want to be informed by data and existing evidence based, and be able to help dispel any myths that might, come across our plates. Goals for implementation. We want to utilize mainstream food retail channels. So this is, how do we currently get food? We want to be able to plug into those systems, grocery stores, farmers markets, local farmers, CSA programs, all of those types of systems. And we don't want to rely on emergency food systems. We really want to keep that as emergency, and utilize these benefits to help us improve food security. We want to certainly minimize operational complexities, make these as streamlined as possible and as efficient as possible, and so that we can get the benefits in the hands of the members. And we certainly want to provide services to meet members where they are. And by normalizing and stabilizing relationships with food, hopefully decreasing social isolation, and really understanding support, and the time that is needed to make a behavior change or some kind of shift, especially if it's related to food systems. And then also considering lived experience and current life transitions. Let's go ahead and go to the next slide. We're taking a trauma-informed lens and approach to how we deliver services. Really, two main considerations there is trauma of any kind can cause a disruption with a healthy relationship with food. And also, food itself can be a source of trauma. And so we want to really be able to support a healthy shift in food and those relationships. When we were designing the health-related social needs nutrition services, we asked the following, and these were really important questions to our team and our work group. Does the food assistance reduce shame, anxiety, confusion, and tension? And whoops, I think I lost the share screen somehow.
Okay, I think somebody lost power or internet, but let me get you there.
Let's see here. Um,
Okay, I
oh,
think
good
you should be able
deal.
to see it. Let me know if you can't.
Oh, I can totally see that. Thank you. So the other questions that we were asking is, does this system, does this program promote safety, dignity, and joy? And does it inspire healing and a healthy relationship with food? So those were all very important questions that we've gone back to. So let's go ahead and go to the next slide if we can. Okay, let's go to the next one. Perfect. So, as we talk about the rollout, we really, are trying to understand eligibility. And we launched in January our medically tailored meal program. and also the nutrition education program. And eligibility is a little bit different for each, so we'll go over that here in a second. But this slide shows kind of that overall health-related social needs service eligibility, to where you certainly need to be eligible for the benefits, be a OHP member. And then let's go to the next slide so we can really hone in on HRSN populations. So we have our covered populations here that are all bulleted out here: young adults with special health care needs, adults and youth discharged from residential mental health or substance use programs, adults and youth released from incarceration, individuals involved in child welfare, individuals transitioning to dual status. It's really that transition time there of, I believe it's 3 months before and then 9 months after, when they shift to that Medicaid, Medicare status. And then individuals who are houseless or at risk of houselessness per the HUD definition. Let's go ahead and move on over to the next slide. So this is a very colorful, somewhat confusing slide, so we'll walk through it. But it's been helpful. We've received some feedback that the visual is nice for some. So this is, kind of honing in on the eligibility for the different services right now. And so on the left side in the blue, that's the eligible population. So we'll be talking about nutrition education first here. So it's really that eligible health-related social needs population. Then when we scooch over to kind of the more green or teal column, then there needs to be a clinical need. And then also, if we move over to the purple column with social need, and all of the social needs for the nutrition benefit really require someone to meet a USDA definition of low food security by a 6-item screener. And if you have any questions on any of this, I'm happy to answer later. And then those are the populations that are eligible for nutrition education. We'll get into a little bit about what that's composed of here in a minute. Then if we look at D, if we go back to that blue column, the waiver eligible populations with a nutrition related health condition. So that's even a more narrow population that would be eligible for medically tailored meals. So they have to, be within that population, have a nutrition-related health condition. And then if we move over to that teal column, they have to have an assessment and a nutrition care plan from a registered dietitian that indicates medically tailored meals. So that's really saying that maybe I have stage 3 kidney disease, then I would qualify to see a registered dietitian. They would make a nutrition care plan for me, and they're like, wow, Shauna, you're having just such low energy, you're having problems going and shopping and preparing your meals, and you don't have that support. So are you thinking that medically tailored meals might meet that need for a while? And then I'd be like, yeah, that would be really helpful for me. So if I have those needs, and then if we go over to the purple column and I screen as having low food security, then medically tailored meals might be a right support tool for me. Let's go ahead and go on to the next slide. So this is an overview of the benefits that we have launched right now. So we have the bullet point, which is the assessment for medically tailored meals. That's also included under this benefit. And because you do need to be assessed and assessed by a registered dietitian, and have that dietitian identify that medically tailored meals would be able to help your condition, and then we get to the medically tailored meal portion of the benefit. And medically tailored meals are just that. They're meals that are tailored to your medical needs. So they're fully prepared meals, and they're helping someone with living with severe, complex, chronic illness. And we really want to be able to have the medical care team and the dietitian, like everybody in the know and supporting this individual to become healthier and utilize medically tailored meals to do that. When we go to the nutrition education component, there's educational strategies and programs that are evidence-based and really steeped on behavior change and to help support the health and well-being of a member. Um, the educational offerings can be group offerings, they can be individual offerings, and it really depends on which CCO a member might be working with as to what the offerings would be. The future benefits are a fruit and veggie benefit, which I'm planning on rolling out at the end of 2025, kind of late fall. So we're working to identify what that will actually look like and everything over the next few months. So more to come on that. And then we have a pantry stocking or a grocery benefit that is going to come out in 2026. That benefit's going to be narrowed a little bit more to only supporting members who are pregnant, children, and WISHN populations. So let's go ahead and go to the next slide. So this is talking a little bit about the assessment and follow-up, and I'm trying to move through these because I know we have so much to cover today. But with that assessment, it's intended to be done by a registered dietitian, and it's billed under Medicaid. It's not necessarily billed under health-related social needs. So those are the numbers for Medicaid billing, if that's interesting to some folks out there. Let's go to the next slide. So this is a little more down in the weeds with medically tailored meals, but these are available at the individual level only. Some of our benefits will be rolled out at household level, but right now, medically tailored meals is individual. And they're not allowed for those that are living in facilities that include meals, maybe be an inpatient stay or something like that. So we don't want to duplicate services. And so that, again, if there's any questions, let me know. Members certainly need to be screened as having low or very low food security, utilizing the 6-item screener. And members also need to be able to safely receive, store, and heat the meals. So this, might not be a benefit for everybody, but someone can receive up to 3 meals a day, 7 days a week for up to 6 months. So that can be quite helpful for some. And then the medically tailored meal menu patterns are created and developed by registered dietitians, and then in so many cases, along with chefs. Let's go to the next slide. So nutrition education, these are some details here that are bulleted out. So nutrition education must be offered to members receiving nutrition benefits, but the next bullet is that members they don't have to do any type of nutrition education to participate with the nutrition service programs, but it's certainly there for them and encouraged. Nutrition education needs to be more than giving handouts, flyers, booklets, and recipes. It truly needs to be evidence-based curriculum behind it. Um, and uh, have an appropriate focus for the population, certainly be trauma informed. And even though USDA programs wouldn't be able to be reimbursed because they're already funded, um, the SNAP Ed and WIC and OSU extension programs are just amazing programs. And so truly, keep supporting members to get into those programs. It might really meet their exact need. And then just a quick reminder that diabetes prevention program is already covered by Medicaid. Let's go ahead and go to the next slide. So for members requesting nutrition benefits, so if they're an open card member, they can call the number here. And then if you're a coordinated care organization member or a CCO member, then call your CCO, but we've also collated this information on our nutrition, on our health-related social needs nutrition website to where you can go to the open card information and call, or you can get the request form. And then we've collated all of the CCO health-related social needs request forms for you to just simply be able to click and get to those request forms and then be able to put in your request. So either phone or by utilizing the form by email, or sometimes an automatic submit, is a great way to request. And if any confusion there, please give us a call, and there's a lot of representatives that will be able to help members through and navigate those requests. Let's see here. Let's go to the next slide. I think this is the end slide. So just my contact information on there. I can also put it in the chat for you for sure. That was a very quick, very fast kind of throwing out of a lot of information, but do we have any questions?
Not seeing any in the Q&A or in the chat right now, but if anybody wants to unmute, feel free to do so.
Okay, well, if you have any, then please let me know. And thank you so much for having me this afternoon. So appreciate being here.
Thank you, Shauna. All right, and so we'll go ahead and move on to our OHP Bridge updates. And I think for that we have Katie Waldo. So Katie, go ahead and take it away.
Thank you. Can you hear me? Okay, great.
Yes.
I moved my microphones around right before getting on. So hi, everyone. My name is Katie Waldo. I use she, her pronouns, and I'm the lead project manager for OHP Bridge. If you haven't met me before, I'm excited that you're here today. So we're just going to go through our kind of standard updates, and then I will be handing it off to Sean for our community partner inquiries. So you can go to the next slide. So for those of you who might be attending for the first time or maybe has not heard about OHP Bridge, this is a new benefit that launched back in July of 2024, so just last year. It is a new benefit for adults with higher incomes in the state of Oregon, and it has some kind of different eligibility criteria for compared to our OHP plus population. So you do have to have an income up to 200% of the federal poverty level. You do have to be an adult, so this is for individuals 19 to 64. You can't have access to another form of affordable health insurance, so that's where that 64-year-old kind of age cap comes in, because you can't be eligible for both Medicare and OHP Bridge. You also have to have an eligible citizenship or immigration status to qualify. Benefit-wise, OHP Bridge is almost exactly the same as OHP Plus, and just like OHP Plus, it offers free coverage with no member costs, such as copays or deductibles. So it should feel very similar to people who may be moving between the two programs. You can go on to the next slide. When we built the program and we're heading towards launch, we knew that folks would be kind of moving into OHP Bridge from 3 key populations. The first was individuals who are moving from the Oregon Health Plan. So they may have incomes between 138 and 200% of the federal poverty level. And we knew that they would be moving over, especially from our temporary Medicaid expansion, which was a program that existed that we put in place following the end of the public health emergency in order to hold the people we thought would be in this population in coverage until we were able to launch OHP Bridge. So folks may be coming from OHP, either from the temporary Medicaid expansion or now more so if they see their income fluctuate. We also know that there are folks moving into OHP Bridge who have previously been uninsured. And then third, we've got folks moving from marketplace plans into OHP Bridge. And we really are kind of assuming that a majority of these folks will move into OHP Bridge during the open enrollment period. So we've already kind of started to see that this year. That being said, there also might be individuals who move in due to changing their application and things like that. So we'll talk about that here in a moment. So as we kind of leave open enrollment and look at how folks might be moving from the marketplace into Bridge, we wanted to flag a couple of things for individuals to be aware of, both for this most recent open enrollment, but also as they head into it for the next couple of years, is that individuals who want to keep their marketplace plans, there could be a few reasons why someone might want to do this. For instance, if they have a provider that they really like and they're unsure if that individual is going to be available on OHP Bridge or OHP Plus. So if folks want to keep that marketplace plan for as long as they can, there's a couple of things they can do. They can agree to auto enrollment for the next plan year. And they can basically, if they don't have to make any updates to their application. We do want to note that if an individual has some kind of change in their life circumstances, they do need to update their application. So this isn't a situation where we're encouraging people to simply not make updates in order to avoid potentially becoming eligible for OHP Bridge. But if they happen to be in a situation where they have not needed to provide any updates and they've agreed to auto enrollment, then they will be in a situation where they're able to keep their marketplace plan for longer. That being said, if individuals do find themselves in a situation where healthcare.gov is telling them that they might be eligible for OHP Bridge or is sending them to the one system to be determined eligible, we do want to flag and rule the marketplace will not terminate coverage for folks. So they will need to contact the marketplace if they find out they're eligible for OHP Bridge in order to cancel their plan or set up a cancellation. With this, we do really want to not warn, but just remind everybody that we want to avoid coverage gaps here. So if somebody finds out that they're eligible for OHP Bridge and they have a future enrollment date, which is basically always the case for this program, we do want to really encourage you all to remind people that they'll want to set up the close of their marketplace coverage so that it aligns with the start of their OHP Bridge coverage, so that they avoid a gap between when their marketplace plan ends and OHP Bridge coverage begins. So just really keep that in mind if folks come to you with questions. So we do want to also flag a resource for folks that is new as of this most recent open enrollment period, and that is our new marketplace web page, which includes there's a link on the screen, so when this is sent out or posted, you can access that there. But this does provide a lot of really, really helpful information and context for folks who might be in a position of moving from the marketplace onto OHP Bridge or vice versa. And we also want to flag that when the marketplace will indicate that someone might be eligible for OHP Bridge, that they'll send them language saying that they may be eligible for a Medicaid program or some form of state-based medical program. And we want to also make sure that we're reminding people that that is not a final decision, that just means that they've been sent over to one in order to be for the state program for the state system to determine if they are eligible. So we know that might be a little bit confusing for folks. So we want to flag that this is the language they will likely be receiving in that case. Okay. So if you do have an applicant who has been sent over to the one system from healthcare.gov and they are kind of asking what the situation is, we encourage you to remind them that This means they, again, may be eligible for a state-based medical program such as OHP or OHP Bridge, but that the One System can take up to 45 days to give them a determination. So to tell them what program they are eligible for if they do end up being eligible for a state-based program or state-funded program. In this case, we do want to remind you of if somebody is determined eligible for OHP Bridge, their start date, so the day of their coverage begins, is based on the date that the decision is made, not the date of the application. And this is important because OHP Bridge does use the marketplace logic when it comes to enrollment dates. So if someone is determined on or before the 15th of the month, their coverage starts the 1st of the following month. If they're determined eligible on the 15th or through the end of a month, then their start date for coverage is the month following. Apologies if that was a little unclear, but there are resources on the OHP Bridge webpage as well to kind of visualize how these start dates work, because we know they can be a little bit confusing. So because there can be a little bit of a delay as far as when OHP Bridge coverage starts, we do want to remind folks that if there are urgent needs for benefits or a decision that is taking longer than 45 days, they can access the Community Partner Access Line or One Customer Service in order to try and expedite that processing. So if there's somebody that has a really urgent medical need, we really encourage folks to do that in this case. Okay.
Alrighty, and then I'm taking it from here, I think. My name is Sean McNulty. I'm OHP Member Communications Coordinator. We use this meeting as one way to share out all of the OHP Bridge questions we get over the month. You can send one in via the email we've got on screen or the registration form for this meeting series as well. But we repeat those back to you all as well, because when one person has a question, there's usually more out there. First one we got this month from a partner was, can a non-Magi client qualify for Bridge? The term non-Magi here means non-modified adjusted gross income. That's the income standard we use, modified adjusted gross income. Not being based on that means that it's a Medicaid program based on age or disability. So to be a non-Magi client, you'd have to qualify for one of those Medicaid programs based on age or disability. The answer was really no, you can't be non-Magi and qualify for Bridge. However, that's not the same thing as saying that somebody who has disabilities, for instance, can't qualify for Bridge. There are age limits for OHP Bridge at 65, so nobody over that age is going to qualify. But people who are under 65 and have Social Security disability or have a form of disability that isn't qualified for Social Security disability can potentially qualify for OHP Bridge the same as anyone else. It's going to look at their income and then they'd qualify based on that. Social Security disability is a disability program that gives you Medicare after the second year of enrollment. Before they get the Medicare available to them, they might potentially qualify there. And the other question we got was actually from a member. This one was also repeated in Oregon Health News, but it was basically the same question we got that Katie just stated about the marketplace transfers. This was a member asking, what do I do after that step? So after 45 days of processing, you'd receive a notice in the mail. But if you have those urgent medical needs, we really want them calling in order to expedite that application and make sure they're getting coverage as soon as possible when there's urgent medical needs. Clients can do that themselves, but partners being able to do so yourself is probably the most helpful thing. So we have a little add-on in this section where if you are approved for OHP at that point, we want you to report the OHP start date to healthcare.gov as soon as possible, because you can't have overlapping tax credits and OHP, if any form, whether that's OHP or OHP Bridge, for more than a month or so. It's 1 month after your notification that you've been approved from OHP. So we want you to go back and get that terminated out. If you're moving to OHP, terminate out the marketplace plan. Otherwise, you might have to repay taxes at the end of the year. We are seeing a lot of these questions right now still, because if you were one of the people who applied at the very end of open enrollment, you had until the 15th of the month to apply there. Then we have another 45 days to process the OHP application on our side. And then there's the future start date logic there. So if someone gets approved in the next 4 days, they're starting in March 1st. So if you have any clients that are in that situation, we really want to get them moving quickly to hopefully get coverage sooner than later. Alrighty. Unless we have any questions about OHP Bridge, we're going to move on to the other OHP updates, starting with the pandemic unwinding. So we are nearly 5 years into the pandemic emergency anniversary at this point. So I won't go too far into this slide, but we are basically heading into the final month. The pandemic unwinding will actually be formally complete at the end of February 2025. So only a few weeks left. At this point, 99.8% of renewals are complete. There are The remainder of those will be complete by the end of this month, though there are about 500 renewals that are people who moved between cases during the unwinding and as a result have a slightly longer schedule. Those folks will be complete by the end of the year, but we're going to be considering the unwinding project wrapped up at the end of the month and then publishing all of our final reports, recommendations, what we learned from the process, some demographic analysis, all that stuff in March. The numbers haven't changed too much since last month. We have over 80% of people still continuing benefits. The benefit reduction category continues to increase slightly, and the benefits ending has actually gone down slightly since last month, as more people have responded and prevented their cases from closing or restored them after closing. As a reminder, there's the 90-day reconsideration period where you can reopen your case without a new application, and some people are taking advantage of that. In the last phase of renewals, which included a lot more people with Oregon Supplemental Income Program, which is one of those non-Magi programs for people who are either aged or disabled. Due to those renewals falling in this last phase of renewals, we've seen the benefit reduction category in particular increase for renewals since last June. You can see it's 20% of the total experience of folks right now, and even higher than the benefits ending category. We've got some slides coming up on specifically how to talk to this population, but those are really the difference in eligibility rules for that population driving that difference in outcomes. We've been hearing a lot of feedback lately about how there's some disparity in outcomes there that's inequitable. Those rules really descend from the Affordable Care Act itself. The federal government, back when they were preparing to implement the Medicaid expansion as part of the Affordable Care Act, got a lot of feedback about the conversion from the old non-Magi rules to Magi income-based rules, the same ones used for adult programs. There was a lot of resistance to that at the time and worry about people losing their benefits, so the federal government did not convert over to that new standard. And we're kind of seeing the consequence of that on a state level here. There are some state policy options to be able to adjust those limits ourselves if the legislature put the funding up for that. So we are monitoring our options like other states have done. California in particular has managed to fully even out the income limits and resource limits for non-Magi versus Magi programs. But in the absence of that, under the federal baseline rules that we use, when you become 65 or get Medicare through disability, the income limit significantly decreases from the 1732 number, that was the 2024 number, we got a slide later about that, down into the mid 900s. So there's a significantly lower income threshold to retain full OHP. The income limits for Medicare savings programs are much more similar, which is where we see that benefit reduction increase coming from. So for member assistance, we still have people who are losing benefits through the end of February. That'll be the final terminations. And then within roughly 60 days of that, we really want them getting over to find their next options. First step is always going to be to make sure the information we used to make that decision was correct, report any changes, ask for a hearing at that step. And especially if you didn't at that time need, the previous renewal didn't need long-term services and supports and are interested in pursuing that now, it's a really great time to request that extra screening and see if you can be eligible to keep benefits through the other programs. Otherwise, members who are found over resource limits specifically might have options to redistribute those financial resources in order to remain eligible if they can get them back below the limit. Though members who are over the resource limits should always speak to an eligibility worker before making any financial decisions. There are complicated rules about how to spend down resources and still be eligible, so we don't want people preventing themselves from being eligible going forward or giving away resources unnecessarily or anything like that. We really want them talking to the eligibility worker. As your role as a community partner, we want you making that connection to the eligibility worker to talk through these questions and making sure and telling them why that's worthwhile. After you're confident in the decision that it was correct that the person's losing benefits, all changes have been reported and the decision was made correctly there. The next step was we really want them going to get Medicare choice counseling assistance from either a senior health insurance benefits assistance counselor or a Medicare insurance agent or broker, both of which can be found at the OregonHealthcare.gov/get help locator tool. There are several different windows that are relevant to them, but the shortest of them is the 63-day window to consider enrolling in a Medigap plan after losing OHP. They can also choose a Medicare Advantage plan or Part D plan, which is prescription drugs. This is kind of like a special enrollment period for them. They use different terms in Medicare, but getting them over to make that decision within 63 days keeps their full range of options open. We want to make sure that they have that. If someone's keeping a Medicare savings program, we really also want them to make sure they know what benefits they're keeping, if that's going to affect that Medicare plan decision that they're making with a senior health insurance benefits counselor or insurance agent. See, there are two levels in the Medicare savings program, kind of categories of benefits. There's the QMB program, Qualified Medicare Beneficiary, which provides secondary coverage. So they get Medicare as the primary coverage, and then OHP pays the remainder of the bills, but following Medicare coverage rules. So there's no additional benefits like dental or non-emergency transportation, health-related social needs, anything like that. But they get Medicaid secondary coverage. If they have that, it's very similar to a Medigap plan, and they may not need to enroll in other types of coverage, though they should still talk with a senior health insurance benefits counselor in order to validate that decision and make sure it's the right one for them. They can still enroll in a Medicare Advantage plan or a Part D plan, things like that as well. But for people who only have one of the Part B premiums only levels of benefit, the special low-income Medicare beneficiary or the qualifying individual programs, if they're only getting that benefit, they do not receive any coverage at all from us. It is just the payment of the Part B premium, the $170-something that gets taken out of their Social Security check every month in order to pay for the Medicare. Paying that's great. It's a 10% income increase for anyone who's able to qualify for it, but that doesn't provide any additional benefits. So they really need to go get that other counseling about their Medicare options in that situation. We really want to make sure people who are losing benefits are transitioning to Medicare as best they can and not having major disruptions in their actual healthcare plans and whatnot. So that's most of what's going on in Lining at the moment. Otherwise, we are heading into full normalization of all timelines. Renewal response timelines by default are 30 days before we send you a notice that we will close your benefits if you haven't responded. So we're fully moved back to that at this point. The unwinding is basically coming to an end. So thank you all for all of the work you've done over many years of making this happen, both enrolling people during the pandemic emergency and then helping them figure out where their next coverage home is at the end of this. So for 80% of them, it's continuing OHP, which is great to see. So we have a few other OHP updates this month. The most complicated of which is going to be the renewal rebalance. So there is an upcoming renewal date shift. It's going to be happening next month in March, actually. This is the last stage of us making the shift from 1-year to 2-year renewal periods. So we did 90% of the unwinding renewals back in 2023. And because we're switching from the 1-year to 2-year cycles, that would set us up to have 90% of the renewals in 2025 and then 90% in 2027, and just have a very unbalanced workload between the 2 years, both for our own staff and community partners. In order to avoid that, we need to make some shifts to renewal dates. This is basically why the renewal dates don't currently appear in notices, is because there's currently no way for partners or an individual member to know their next renewal date for certain. That will solidify after the March update where we rebalance those renewal dates though. So right now, the renewal dates for this renewal cycle will not often align with the end of the continuous eligibility period. We have that continuous eligibility period in the notices where they can keep benefits for 2 years, regardless of even if their income changes. As a result of implementing that policy and having to remove the renewal dates, to move renewal dates, those renewal dates this time are not going to line up with the end of the continuous eligibility period necessarily. For many of people, they will, for the majority maybe. But after the next renewal cycle, after we make the shift and people go through renewal one more time, the continuous eligibility periods and renewal dates will predictably line up. And we're looking at our options to return renewal dates back into the notices and make them as clear as possible to members in whatever form. So that's the intent of the change there. How that affects members, it gets a little bit more complicated. The main message we want you driving, though, is that people will keep benefits until the end of their continuous eligibility period, and then we're going to contact them when they need to renew. They should keep reporting changes as those occur, though. As a consequence of this, people's renewals are going to be delayed by several months after the end of their continuous eligibility period. We're not going to be shortening anyone's continuous eligibility period or shortening the renewal dates. It's always going to be extending them. How this interacts with reporting changes gets a bit complicated. So in order to make sure we have as many people go through the renewal process as possible, we're not going to push out renewal dates for anyone who has invoked their continuous eligibility, meaning they have reported that they're over income, for instance, and are no longer qualified based on the normal income limits and are only keeping benefits due to continuous eligibility. We're not going to move that person's renewal because we think they're over income. We want them to go through the renewal process and see if they're eligible or not at that point. However, if someone reports a change in income after their continuous eligibility period ends, but before we've contacted them for renewal, it is possible benefits would end following our normal timelines, which would be the end of the following month, or end of this month if it's by the 20th of the month, or the end of the following month if the decision is made after the 20th of the month. So you are predictably going to keep benefits during your continuous eligibility period. Then there's going to be a window where we have not contacted you for a renewal yet. If people are reporting changes during that time, they can lose benefits and would not go through the renewal process at that stage. So there's a little gap there. We want you all to be aware of that. Reporting changes is still required, and people still will have the special enrollment periods to get marketplace coverage or can reapply for OHP. So there shouldn't be enormous impact to members, but it's going to be a confusing process for many of you and your clients. So we wanted to provide this information upfront as best as we can. We're also not going to be moving renewals for any OHP Bridge members. This includes both the OHP Bridge Basic Health Program members who have annual renewals, as well as the Basic Medicaid members who do have the 2-year renewal cycles and continuous eligibility periods. So it's going to be a complicated change, especially around the reporting changes thing. But with the final step here done, we will have moved fully to 2-year renewal cycles, and for nearly all members except for certain long-term care programs and the OHP Bridge members who have the 1-year renewals still. We're glad to have this happening, and hopefully will be an overall reduction in workload in the long term, though this final stage is going to have some extra confusion coming up there. If there's any questions about this, I'd love to hear those. Otherwise, I'm going to keep moving along through the changes in the interest of time. So other change that happens every March of every year is that the annual income limit takes effect. The annual income limit update takes effect for most of OHP's programs. So that this year is going to be a 3.9% increase, which helpfully for quoting it to clients and whatnot, is going to be exactly $1,800 this year for a single adult. So that'll be the new income limit for OHP Plus. The charts that explain this for all the different programs we have are in the process of being updated for the core CPOP chart that you might be using most. However, the marketplace eligibility chart for 2025 is already available at orhim.info/resources. I don't think we expect the community partner income chart to be out by the end of the month. So I'd really take a look at that marketplace one, go download that and have that ready for helping clients apply for benefits using the new income limits in March. Otherwise, there was also a new update to the 7210 paper application that came out in the last month. This update was in process since 2023 and came out a little bit unexpectedly on our end. So apologies for not being able to tell you all this in advance, but it's already up on that form server. You can either go to ohp.oregon.gov/forms and click the search tool on the right sidebar, or go to that longer link I've got on the screen there. And then 7210 is the form code to get the new application. The changes on this one are pretty minor. It added a question under the veteran status list of questions, asking if they've ever been active duty, which is used for veteran dental eligibility. There's also a question added to the former foster youth, or question updated on the former foster youth section, removing the mention of Oregon, since in 2023, the former foster youth medical program now offers eligibility regardless of which state you aged out of foster care in. There was also a few updates to demographic questions made, as well as adding in some marketplace referral information to the signature page about what they're agreeing to. All of these updates are pretty minor and are separate from the conversation we've been having about 7210 updates in this group and other areas about making larger changes. Those are going to be coming later down in the process, but this is separate from that. In the meantime, go grab your latest paper applications and update to the latest form if you're still using those frequently. Otherwise, also this month there were some new demographic questions. Next month there are some new demographic questions being added to one as well. There will be questions about pronouns and sex that have been reworked in the household member information screens. That's the place that the demographic questions currently live. And then the race ethnicity questions are going to be moved from the household member information screens over to a new demographic screen, which will include disability and specific accommodations people need for their disability, as well as more questions about sexual orientation and gender identity than have been in there previously. I've got a few screenshots of these. These were also shared through our collaborative, so I'm going to speed through this content a little bit, but there's a bunch of changes for the adding pronouns, as well as what pronouns they should use when communicating, and the rework of the federal identification, where we have to ask the binary sex option as well. There have also been some additional demographics. In the new demographic screen, we have added the Realty and Soji questions that were moved from the previous screens, as well as adding new fields for identifying race. We've got a screenshot here on the right. Hopefully those are fairly self-explanatory, but moving that from the household member information screen should make those individually shorter as well and easier to get through that section without timing out. So hopefully that's helpful. Please continue to provide feedback about any of these screens and how these are working for members, and we'll continue to make the system as best we can. Then the new disability questions are if individual identifies as someone with a disability or having a physical, mental, emotional, cognitive, or intellectual condition, describe the disability or condition in any way they would prefer. This allows them to note their condition specifics in a way that hasn't been possible before, and select some accommodations that are helpful for them, but better puts that data into the system so it can be passed along to places it's useful. Okay, that's it for updates for this month. It looks like we have a question or two in chat.
I don't know about one of them was just from Shauna asking if people had questions. So it's not a question, more her contact information. And then there was just a comment about how the new questions are optional. So people have a right to decline to answer them if they don't want to, but assisters are required to ask the questions. It's just people do, however, and there is an option that says, I decline to answer, or I choose not to answer. I forget exactly how it's worded, but yeah, we just wanted to clarify that too.
Yeah, those questions provide us important data for knowing how many languages to order of each type of document and all sorts of things, as well as make sure that we're not missing out if there's care disparities for a specific population or whatnot. All of that data is helpful in to make sure the system's reaching all people it needs to be equitably. So thank you for your help in that, even though it often comes up with difficult conversations or folks who don't want to answer those questions. It's important to be asking.
Oh, somebody's asking about where to find the new federal poverty limit charts.
So go to the marketplace site, that is ORHIM, or Oregon Health Insurance Marketplace, orhim.info/resources. And then there's going to be a drop down for federal poverty level eligibility charts. And there's going to be 2 of them listed, one of which is this year's up until March. And then there's a March 2025 through October one that they've got. That's the one you're looking for. That's the updated one. The other one is in the process of being updated, but we'll get that shared out as soon as it's done. But we're working through the speed of the state on that.
Posting the link to that resource page in the chat too.
Thank you.
And then you just have to expand the little sections, and then it'll give you the
and then they're all
bilingual. A lot of really good resources.
They're all bilingual as well. So there's not an English one. Just click one of the Spanish ones, for instance, and that'll have both English and Spanish on it.
Any other questions? And feel free to unmute to ask the questions if you feel comfortable.
Or on other topics. It doesn't have to be things we presented on today. If you're hearing things from your partners or from your clients and whatnot at the moment, we'd love to hear it. So otherwise, next session, we'll be talking a little bit more about federal response or response to federal policy changes and just understanding those and trying to set up a bit more framework of how to understand changes as you hear about them on short notice. So
If you have, I would say if you have any topics that you want us to cover, I think we're always happy to hear about topics that you all might be interested in for future webinars.